we're going to talk about this morning are our techniques that we use in the middle phase, working within each of these problem areas in order to implement the strategies. And I want to point out that it's not that we created and invented any new techniques that you probably haven't seen before, but we've taken techniques that are part of good psychotherapy and packaged them in a way that we feel makes them effective. So the ones that we're going to talk about this morning are psychoeducation, exploration and expression of feelings, clarification of expectations for the relationship, how we help these adolescents develop better communication skills, how we use our relationship with the adolescent in order to give them the opportunity to practice and develop these skills in a safe place. Role playing, which is not unique to IPT, but is a very important technique in order to help the kids learn how to utilize these skills and internalize them and feel that they can go outside of the therapy session and use them effectively. And then what we call work at home. We don't like to call things homework, and in fact, I usually call them interpersonal experiments. But it's our exercises that we send the kids home to do in between sessions. So we're going to talk in a lot of detail about these this morning. To start with, I just want to talk about how we use exploratory techniques in IPT. Obviously, you've all been trained in how to do psychotherapy, so you've been taught about open-ended questions, questions that you ask that the adolescent can ask with a yes or no answer. This is really important in working with teens because they'll be more than happy to just respond monosyllabically. And so you have to really think about how you can reword your questions to be open-ended. What did that look like instead of did you do that or did you not do that? What did it look like? How did you respond to that? Instead of saying, well, did you walk into your room and shut the door? You don't want them to be able to shut down the communication with you with just a yes or no answer. You really want to be able to have them open it up. And your open-ended questions pull for descriptors, and that's what you're really looking for. You want to hear how that adolescent is going to describe their interpersonal interaction. Non-directive supportive acknowledgement statements are also very important in working with adolescents because most of our adolescents feel like the other person and significant people in their life don't really hear what they're saying. So they come to you already feeling that nobody understands them, nobody knows what they're going through. So it's really important to be able to, in some capacity, to reflect back to them and say, it sounds like you're feeling irritable. It sounds like that was really upsetting for you. It sounds like you feel like your parent really didn't understand what you were trying to say to them. The thing to be careful is you don't want to reflect so much that your comments don't take your interaction to the next level. And I think sometimes therapists can make the mistake of just spending too much of the session just reflecting what the adolescent has said. And I think it's important to note that you can also show that you've heard what they're saying by following up their statement with a question that's picking up on what they said. That's another way to show supportive acknowledgement that you heard what they were saying. And another exploratory technique is our targeted questioning, and this is critical in a short-term treatment. So you're really wearing your detective hat, particularly as you hear about the kids' interactions with the other person that you're focusing on. And so you start out with your open-ended question because you're exploring your hypotheses of what may be going wrong in this relationship and what may be the communication problem. But in order to hone in on it and confirm your hypothesis, you need to ask more targeted questions. Well, how did you say that to your father? You told me that you felt you told Dad that you didn't want to go there. How did you tell him that you said that? You want to get your examples. Your targeted questioning is very important so that you can really see, well, they said they told them, but did they really tell them? They may have thought that they told them, but when you get more targeted questions and more specific answers, you find out that they really didn't do what they thought they did. So the targeted questioning is very important to get that level of information. So, as I said, the exploratory techniques are really important to use with adolescents because the open-ended questions gives them a chance to be heard. It gives them a sense that they are somewhat in control of the therapy situation and that they're bringing in their material and having the chance to tell you what they think is the problem. But they still require that structure to focus their experience because they're so reactive to everything that's happening on a day-to-day basis that without you structuring it with your targeted questioning, your sessions will be too diffuse to really accomplish anything. So your challenge as a therapist is to find the right balance between directive and non-directive questioning, especially while you're doing your inventory, and then again in the middle phase while you're trying to get information on that interaction that you're targeting possibly to help them do a different way or to help the next interaction with that person go better. So a very important technique of our middle phase is what we call communication analysis. The goal of our communication analysis technique is to really help the adolescent understand the impact of both their verbal and nonverbal communication on the relationship and the other person. So we're looking at the impact of their words, their nonverbals with adolescents, the eyeball rolling, the twist of the shoulder, the sighing, the shrugging of the shoulders, the turning their back on the parent. These are all really important things that we want to point out with the kids that also communicate a lot to their parent when they don't necessarily realize it. We want to talk to them about what are the feelings that they engender in the other person with these kinds of verbal and nonverbal communications. And then what we really want to teach the kids is the cyclical nature of communication. If you say something to somebody else, it's sending a message to them, and that message is going to create a feeling in that other person. And whatever that person feels is going to influence the response that they give to the adolescent. And that response is in turn going to influence how that adolescent feels and what they say next. And what we want to emphasize to the kids is we can change that interaction in any of those points. What you say to your parent or your best friend, how you say it, is going to influence their feeling and is going to influence the response you get back. So you can be a very active agent in how that interaction goes and how it makes you feel as a person. So we're really showing the kids that you can change one small thing that you say and it can really change the relationship. So our cartoon. Look, Mom, you just can't barge into my room anymore. Why not? What are you trying to hide? Nothing. It's an issue of privacy. What do you want to keep private from me? Nothing. This is about boundaries. Oh, then there's something you don't want me to see. No, I mean, yes. I mean, you'll never understand me. I think we can both agree on that. So they're not communicating very clearly. He's not communicating. He's saying things that aren't really what he wants to say to Mom. And the effect that it's having on Mom is she's getting more suspicious, and she wants more than ever to come into his room because he's sort of bumbled his way through excuses of why he doesn't want Mom to come into his room. So we would work with him on being more accurate and in his communication to Mom about what it is that he's wants her to be involved in and what he doesn't want her to be involved in, and what's normative for somebody his age in terms of privacy. So in order to do the communication analysis, we ask the kids to come in and talk to us about a conflict or a conversation that didn't go well very specifically. So we want them to report to us, really sentence by sentence, if possible, how that conversation went. So they might come in and say, I had a fight with my best friend. So we would ask them, how did it start? Who started the conversation? What did your friend say to you? Your friend started the conversation. What were you doing? Well, we were hanging out. We were waiting for a pickup game of basketball. and he started saying these, nasty things about me. So what did you say? How did that make you feel when he said those things? And we would ask the kids to say, what did he exactly say? He said, told me I was a loser, I was no good, nobody really wanted me on the team, they just didn't want to tell me that. How did that make you feel? What did you say back? How do you think that made him feel? What did he say back to you? And you're getting the conversation sentence by sentence, but also stopping that interaction in order to help them identify the feelings that were engendered in him by that communication, and also encouraging some perspective taking. What were the feelings that were engendered in the other person by what he responded back? And the other important aspect of this is asking the adolescent, well, now that you've thought about what you said, was that the message that you wanted to convey? That's what you said. But now that you see the feelings that went along with that statement, was that really the message that you wanted to convey to that person? And if not, what could you have said differently that would have been more accurate? And how could you have said it differently that might have gotten a different response and may have made you feel better? So could you have said to the friend, I feel my feelings are hurt when you say things like that. It feels really badly to hear that. I'm just wondering if there was something that I did, rather than answering instead with a very angry, well, you stink, I don't want to play with you either, kind of thing, which really wasn't what he was feeling. What he's feeling is he's feeling hurt. And would the friend respond differently if he could express the fact that he was feeling hurt? And how would that interaction have changed? And maybe he wouldn't have ended up feeling as badly about himself, and he and the friend wouldn't have ended up in such a bad situation. Any questions about that? Because it's really important to get that process. No? Okay.
Comment.
Yes.
So I think that one of the things that happens when we teach communication analysis is people think that they can do that very quickly. And often you'll start to dissect a communication, and within the first 2 or 3 interactions, you think you have a really good understanding of what went wrong in the conversation, and so you don't continue on to hear more. And it is important, and I think takes time to feel confident that you've gotten the information that you need, particularly for kids who have bad communication with the other people in their lives. Everyone's sort of used to them not being so nice to each other. So in fact, what you're hearing as a therapist is, oh, that's really where it must have gone bad. In fact, the other person was okay with that response because they're used to talking that way. And it was, in fact, 3 or 4 interactions later that the child said something that was really inappropriate, that really made the situation escalate. So I think that communication analysis does take time, and it requires you really dissecting it down. There are some interactions that are just 2 or 3 words, so that obviously doesn't take a long time, but then you have other interactions that are much bigger and longer, and so you do want to spend the time to do it. The other thing that happens is typically the answer is, I don't remember what happened. And we can train them to remember by asking these questions, and also in our discussion as we talk about the middle phase, that this is something we're going to be doing each session. So it is important in the role play, for instance, as Laura did. Maybe you want to write down the details so that we can remember. And you can help them to remember by kind of creating the scene, sort of as if you were, playing back a video. So if we were playing back a video of this event, set the stage for me a little bit. Where were you? What were you doing when you had the conversation? And then as you start to ask the questions, they can provide a little bit more detail. So the first time you do a communication analysis, often you get a lot of I don't know, I don't remember, and it's sort of vague. But as you do it over time, you learn more. Is it accurate? Probably not 100% accurate. We do communication analysis sometimes in the groups where we've all watched the interaction and we still can't remember as a group what people said. So it's not meant to necessarily be the most accurate, but it does give you some information. And even if it's not 100% accurate, they're not so self-serving that they're not telling you a lot of things that they did and said wrong in the conversation, so it can still be really useful. So don't get so caught up on, is that exactly right, but their memory of it, and try to get as much information as you can about the details.
And you really, as Jamie said, you're going to train them to do this. The first time you do it is going to be much vaguer than when they continue to learn how to do it. And you can ask them questions to jog their memory and let them know, it doesn't have to be perfect. We just want to get a sense and begin to look at how you're communicating and your impact on other people so that we can figure out where would be best to help you to do things differently. So it's a process. It's a process that goes throughout the middle phase, and you repeatedly do with the adolescents over the course of different sessions. Another technique is decision analysis, and we're going to talk a little bit about how communication analysis, decision analysis, and role-playing all come together this morning. But decision analysis is very similar to cognitive behavior therapy steps in problem solving. So what we do is in IPT is we do it within the interpersonal framework. We're looking at a situation, an interpersonal situation, where the adolescent can have a decision point. They're having a conflict or in a transition. They've had trouble making that transition in the new situation, and they get to think about, well, is there something that I would like to change in this situation that would help me feel better about it? And how can I present that to the other person who's in this new situation with me? So one of the things that you can do is sort of help the adolescent, one, identify what the problem is, what's not working in the situation, what is the identified conflict that they have with the other person. You can't start a decision analysis until you truly have identified what the problem is and what it is that you're looking to negotiate. The other important aspect of this is helping the adolescent to generate a number of solutions to consider. So we all work with adolescents. One of the major problems with teens is they like to say it's my way or the highway, so to speak. Compromise is not their first instinct. They want what they want their way, and they don't really want to think about somebody else's way. And so part of your job is to start to talk to them about, well, if you only always have this extreme viewpoint, it's often very hard to get people to feel that they want to go with exactly your point of view. But a lot of what we do in life, in our relationships, in our jobs, in school, is finding a compromise, finding a middle ground. And how do we do that? We do that by generating different solutions to the problem where there's different give and take on each person's side, and somebody has to give up a little bit in order to find some area where they can have mutual agreement. So we encourage the adolescents to generate a bunch of different solutions to the problem. So for example, we have adolescents whose parents, an adolescent girl whose parent doesn't want to allow her to go out for very long. And so when they do allow her to go out, calls her every 10 minutes, to check up on where are you, when are you coming home, who are you with? These phone calls get very annoying. They start to have a lot of arguments. The adolescent decides she doesn't want to go out anymore, and she gets depressed because it's too embarrassing that the parents are calling her on her cell phone at all hours of her activity. So what are the possible solutions that we would have her generate? Well, could Mom cut it down to she calls once an hour to find out where they are? Could she make an agreement with Mom that she'll let her know where she's going first, but if they're going to change where they are, she will let Mom know, and she will initiate a call. One of the problems with this girl was Mom was calling so often she stopped answering the telephone. So that made Mom call even more. So she would commit to answering the phone if the phone calls only occurred every so often in a certain frequency. Not every 15 minutes, not every half hour, but less frequently. Could they agree on a time that the girl would have to come home and that she would have to call before she left to come home so that Mom would know approximately what time she would be returning home? So these are all the different types of solutions that you want to help the adolescent generate. And then you want the adolescent to sort of look at the pros and cons of the consequences. So how is mom going to respond to the first option? You know, this is a mom who's calling all the time. How's she going to feel about calling only once an hour? What are mom's concerns? How can you address mom's concerns in your different options? And so we talk to the kids about this. We get them to think about how the other person's going to respond and pick which of the solutions seems the best one that they want to try first to put out there to the other person. And then what we do is we rehearse how they're going to talk to mom about this new strategy. How am I going to explain to mom that I want to try a different calling schedule so that I won't be humiliated when I'm out with my friends that my mom's so overprotective. So I can still go out and enjoy myself, and mom can still feel confident that I'm safe because I am checking in, but I'm just not checking in as frequently. So we would rehearse that conversation, how the adolescent would present her option that she would like to try first to the mom. In between this session and the next, we would rehearse it, practice it, get her ready to do it. She would try that in between sessions, and she would come back the next session where we would review it. We would possibly even do a communication analysis to see how it went, really looking at their communication, their verbalizations, and see if it worked, great. If it didn't work, where could we continue to tweak it so that it could work better on the next try? So that's how the decision analysis can also tie into a communication analysis. So if for some reason that first option didn't work, and even examining it in a communication analysis suggested to us that that's not really the one to try, we would go to our next solution on the line, on our list that we had created, and sort of reevaluate and think, well, maybe this might be a better solution to try. So this is a very common problem-solving technique that we use that's used in other therapies, but we're really doing it in the interpersonal context. How can you change? What are your decision points in negotiating in this relationship in order to make you have the end result that you desire? In following your communication analysis and decision analysis in the session, the work is really going to focus on how can the adolescent effectively communicate what they want to change in that relationship, what they want to communicate in that relationship. And so we teach the kids specific communication skills that we hope they will utilize in these different situations that will be helpful to them. So this is you have this handout you have this sheet in your handout. This is what we call our teen tips. And this sheet has our specific communication skills that we work with the adolescent with. And often we will give this sheet of paper to the adolescent to take home with them as part of our work in the session. We've also, in our dyadic sessions with parents, have given a copy to the parents so they can be aware of the different communication styles that their kids are experimenting with, so that they can be open and receptive to them when the kid comes home speaking to them in a different way. So if you look at the first one, it's aim for good timing. And this is what we call our strike while the iron is cold. One of the things that we work with the adolescents on is that when they're depressed and they get upset, they're a bit dysregulated. And oftentimes when they're feeling dysregulated, they're upset, they're angry, that's not the best time to enter into a conversation about whatever it is happened that made them feel this way, because they're angry and agitated, and chances are the other person is similarly angry and agitated. So one of the things that we like to teach the kids in those situations is strike while the iron is cold. Maybe the better idea is to be able to communicate, you know what, I'm feeling too angry and distressed right now. I don't want to have this conversation. I think we should both cool off and come back in a half hour when I'll be feeling better, and I won't necessarily say something that I may regret later on. And so to learn and to teach the other person as well that we don't do so well when we try and problem solve when we're feeling really angry. Let's take a time out from each other, so to speak. Let's cool off and come back when we're feeling more calm to have this conversation. So that's our strike while the iron is cold. The other part of aim for good timing is many of our adolescents try and ask for something at the worst time. So, you know, there's so many stories and examples the kids have given when we ask them, so when did you try and have a conversation with mom about whether you could go out tomorrow night or whether you could have money to buy another pair of sneakers? Well, she was busy in the kitchen cooking dinner and my younger brother and sister were annoying her. And how did she respond when you asked that? She yelled at me. I don't even know if she heard what I was saying. Why do you think that was? Well, she was really stressed. She's trying to get dinner ready. That's not mom's calmest time for having a conversation. So what we want to teach the kids is aim for good timing. If you approach somebody when they're distracted or they're busy doing something else, half the time they don't even hear what you're saying, but they're so non-focused on you that they just sort of yell at you to go away, or they don't want to listen, or they say not now, and they can't really process what your expression of emotion is, what your request is. And so the important thing that we want to teach kids is to aim for good timing. Let's talk about, when do you think your parent would be most receptive? When do they seem calm and able to listen to you? Well, I think after my mom comes home from work, she's made dinner, everything's cleaned up, she's relaxing on the sofa, she's going to watch her favorite TV show. Well, okay, does she want to be interrupted during her favorite TV show, or should you wait until after the favorite TV show is over? Is it before bed that she's calm and feeling like she can have a conversation? Maybe Sunday is a better day, some kids would say, after she's gone to church, she's feeling relaxed, she's just hanging out at the house. You know, these are the kinds of things that we want the kids to think about. When is the best time to approach somebody where they can really hear what you're saying and give you a measured response back, rather than they're in a rush, they're agitated, too many people in the house are screaming at them, and they can't really focus on what you want them to hear that you want to say. So avoid times when people are feeling tired and upset. Our second communication strategy is the use of I statements. This is really important because we want to encourage the kids to begin to talk to the other person about how they're feeling. But a lot of times kids will do that by starting out with what we call a more blaming statement. You never let me go out. It really stinks. It makes me so angry. I feel like I can never be trusted. Well, if you're the parent and somebody starts out by saying, you never let me do this, you always mistreat me, is the parent really listening to the second half of the statement? No, because they're already angry that you're blaming them for something. But if you start out with your I feel statements, I feel like you never trust me, I feel like, well, we try to avoid the word never. I feel like you don't trust me when you don't give me permission to go out to the movies with my friends, and it makes me feel sad. You know, is the parent going to listen to that in a different way? I think so. I think if you can start out with, I feel sad, I feel hurt, I feel like you're not listening to what I have to say, and I'm feeling upset about that, I feel like I would like to spend more time with you, rather than you spent so much more time with my sister, you like her better, you're going to have a different response. So we really practice with the kids on using I feel statements. The other thing that is important for the kids in using their I feel statements is not to assume that the other person knows how they feel, because a lot of times you'll hear from the adolescents, well, they know I don't like that, they know how I'm feeling. And they assume that the parent or other person can read their mind and understand what they're feeling, but they really can't all the time. Half the time they're too busy and preoccupied with other things, so they're not thinking about you as much as you may hope that they're thinking about you. And so it's really important to put your feelings out there using your I feel statements. Don't assume that the other person knows how you feel. Let them know how you feel using a statement that doesn't come off as blaming. Another specific communication strategy is to give to get, which we call it's our way of helping the adolescents to communicate in a fashion that shows that they understand the other person's perspective. Because the same way that they want to feel understood, the person you're talking to also wants to feel that you understand what they're going through. Or what their experience is. So the way to do that is to start off with a positive statement that shows that you understand how the other person feels. So, Dad, I know that you really love me and you're concerned about me, and that's why you don't want me to be going out this weekend, or you don't want me to go off to that college much further away from home because you're concerned about me. But I feel like you're not understanding that it's time for me to grow up. Starting out with the statement, Dad, I know what you're concerned about. I know you worry when you can't see me as often. Or the adolescent who wants money. They want money to go buy things at the mall. But mom is really strapped for money, and mom's been working hard as a single parent. Instead of saying, Mom, can I have $20 to go to the mall? I really need to buy this shirt because I can't go to school without the latest fashion. Being able to say, Mom, I know that you've been working really hard lately, and I know that money is tight, and I was just wondering, is there a way that I could have some money to go shopping, because I would really like to be able to buy a new shirt. Same request, but starting out with a statement saying that you know that you're asking for something when the parent has other concerns. And that goes a long way towards having the other person hear what you say and consider what you're saying. The other thing that I like to emphasize with the adolescents is a lot of times it's not what they're saying, it's really it's how they're saying. And that's what we're trying to get at with these communication techniques. It's not that you're necessarily asking for something that's so terrible. It's the manner in which you're doing it that's leading to a rejection of your requests. And so, because the parent doesn't feel like you understand their perspective, they feel like you're angry and blaming, and you're asking at a time when they're just too busy with other things to really take into consideration what your request is. So these strategies and communication techniques that may seem obvious to us to talk to somebody this way isn't as obvious to adolescents, and really is something that they need to practice, and something that we spend a lot of time on in the therapy sessions. So for example, I had a patient who the mom and the adolescent continually fought over the fact that she didn't want to clean her room. And part of the reason she didn't ever want to clean her room was she had a mother who, it was never good enough. So, she would clean her room and mom would come in and say, looks nice, but why are those pants on your beanbag chair? Or it looks nice, but you forgot, you forgot to hang up that dress. And so the adolescent felt like, why should I bother? Because it's never good enough and she never can compliment me. So one of the things that we practiced in the therapy session was for the adolescent to be able to say, I feel like it's never good enough when I clean my room. I'm trying really hard to do what you're asking to clean my room, but you always find something wrong with it. Is there a way that I can clean my room? And you can just say, you know what, you did a really good job this week. So she was able to sort of say what she needed to hear in order to feel motivated to do what mom was requesting. instead of just throwing everything all over the room and just not cleaning her room and saying, she knows why I'm not cleaning my room. Mom needed to hear it more directly and in a communication where she could understand, maybe if I'm always still finding something at fault, doesn't make her really want to clean her room the way that I would like her to. So they worked out a compromise. They then went on and did actually a decision analysis of what actually in the room needed to be put away if the kid was going to do the minimum that mom could be satisfied with. So could there still be books on the desk? What needed to be in the drawers? How neat did the bed need to be? Could mom needed a pathway to be able to walk into the room, and the dirty clothes needed to be in the hamper. They then did a decision analysis about what were the most crucial aspects of the room that needed to be picked up, instead of making it this global thing that mom was never able to really specify what were the most important issues in the room. So a lot of what the preparatory work of decision analysis is helping that adolescent to begin to think about what the other person's perspective is and why they may be making certain demands or why they wanted certain solutions that aren't working for the adolescent. As Jamie says, it may be that they broke curfew. They haven't come home on time for multiple nights, and that's why the parent no longer is letting them stay out past 10 o'clock. Or it may be that they got caught stealing something a few weeks ago. Or they gotten phone calls from the school that the adolescent is cutting class, so they're not allowing the teenager to go out after school. They're requiring them to come straight home, and it's sort of a consequence of not being responsible. These are the things we want to help the kids begin to think about, that it could be that previous actions have resulted in these kinds of restrictions or responses from their parent, and how we can't necessarily work with them to immediately get mom to do what they want them to do, but more often, how can you begin to re-earn that trust that will allow you to eventually get the freedom or the things that you want. But first, you have to show that you're deserving of that by behaving in a certain way, acting responsibly. And so this is all part of the decision analysis, because that's the framework within which they're going to have to think about and generate their possible solutions. And this is also where you can address a lot of the different cultural aspects. So, do these concerns, do these rules and regulations, do they come from the fact that your parent was brought up in a very different culture and a very different environment? Can that help you understand why they may have asked you to do these things? And then how can you educate them about where you're growing up and then find a way to, address their concerns, but also work on getting some of the things that you want. So it's an important part of the conversation and problem solving to really think about the other person's perspective. And so that's a huge piece of work with adolescents who generally just think about themselves more than other people. So the other thing in terms of negotiating and the problem solving that's very important for the adolescents is to have several solutions in mind. As we talked about earlier, adolescents really prefer their own one solution, the one thing that they really, really, really want. And as Jamie was saying, that may not be the solution, but there may be something that's an approximation of what they want, that's a midway ground, a midnight curfew rather than 2 a.m. curfew, or being able as a girl to go to the movies if there's other kids going along, so it's not just she and one other boy, but there's a group, and dad drops them off at the movie theater. There's different things that they can approximate and think about. So this is what they have to keep in mind when they're generating different solutions. How it's addressing the parents' concerns while making them happier because it still allows them to get a little bit of what they want. Maybe not all of what they want, but a little bit, and a little bit can often make a big difference in their mood. And then lastly, what's really important for the adolescents is to remind them that things don't work the first time. The same way when you're doing parent management, and the first time you give a consequence to your smaller child, it doesn't always work perfectly the first time. The same way for the adolescents. This isn't, you're changing patterns of communication and problem solving that have existed for a long time possibly, and so the first time you try and change things, it may not work perfectly, and so we want the adolescents to know this is something that they have to keep trying. It's a process. We're going to have to keep tweaking their communications. We're going to have to keep tweaking the way that they're problem solving, the way that they're generating possible solutions, helping them to get better at seeing the other person's perspective and knowing how they can respond to it in a way that will help them feel better, but also addressing the other person's concerns. So what we tell the kids is, you're right, it may not work the first time, but that's data for us, and we want you to come back and tell us if it didn't work so that we can keep working on it. That's not going to make me give up, and it can't make you give up. So a little cartoon. Mom, can you tuck me in? Really? Jeremy, you haven't invited me into your room for ages. What prompted this? I thought it sounded better than would you carry all of my dirty dishes down to the kitchen for me? So Jeremy is not actually being upfront in his communication. He wanted his dishes carried, so he fooled Mom by inviting her in slightly under false pretenses. And so what we want to do with the kids is help them to engage their parent in more accurate pretenses so that they don't get angry when the adolescent has sort of duped them into agreeing to do something that they wouldn't ordinarily have wanted, and then they end up in a conflict. So role-playing, as you've heard us talk about, and we've done a lot as part of this workshop, role-playing is really key to learning new skills. Role-playing in the therapy session gives the adolescent a safe place to practice. It's a place where you can give them feedback, and it's non-threatening because nobody else has seen their practice but you. So you can give them feedback, you can tweak their communication skills prior to them going out and trying it with somebody who may be less accepting initially outside of the therapy session. And the goal is that if you practice enough, they're going to feel much more confident to go out and try it in between sessions. If you don't practice in the session and you just talk about it, you have a much less likely chance that they're going to go out and try something new if they haven't felt like they've made it their own and it fits with them and they've given it enough of a shot to feel that it's possible to do. So role-playing is an active technique. We just don't talk about what we would like it to be, we act it out. And as Jamie said yesterday, as therapists, we sometimes have as much trouble role-playing as our patients do. You sort of put yourself out there. We've put ourselves out there these 2 days, but it's important to really do that because otherwise it doesn't have the same effect on changing their behaviors outside of the session. So you have to be prepared as a therapist to initially try and coax some of your adolescents to do it. So many of our kids say, no, I really don't want to do that. No, can we just talk about it? And what we like to do with those kids is sort of lead them to the role-playing gradually. So I like to give the kids the analogy of it's sort of like you're putting on your favorite television show, right? So you're in Hollywood, the actors and actresses all sit down, somebody's written the script, they talk through the script, they tweak the script, they do a dress rehearsal, which they may have practiced and then do a dress rehearsal, and then they have their final performance. And that's similar to what we can do in the therapy session. We can prepare what you want to say before we rehearse it. We can talk through it, and then gradually, after you've talked through it, they're more likely to be willing to take on the actual role and practice it before you feel they can go and do it outside of the session. But it's very important to set up the role play, and this is part of their anxiety. If you don't do this, they don't know what's expected of them. They say they don't know what to say. So part of setting up your role play is thinking about, if you're role playing a conversation, what is the goal of that conversation? Without thinking about how you're going to do it already, what is it that you want to convey? What do you want to get out of this conversation? So do you want somebody to understand how you're feeling? Do you want to be able to get to do something that you couldn't do before? What is it that you want to end up with at the end of the conversation? And then how can you say it in the way that's most likely to get you the positive outcome that you want? What are some of our teen tips that you would have to use? And so we'll even pull out these teen tips and sort of look at it and evaluate, so which of these tips do you think would be helpful to use, and how would they be helpful in which of the situations? Again, we also want to focus on how would you start the conversation. It's really important not to send the kids out without thinking about how they're going to initiate. When are they going to have this conversation? So aim for good timing. What are they going to start out with? Are they going to make an appointment to have this conversation? Dad, there's something I'd like to talk to you about. When would be a good time for us to sit down and talk about it? They have to think about what the other person's response is going to be and how they're going to respond to that. And so it allows you to come up with a little bit of a script of the first initial aspects of the role play to start the kid going. The other thing that's really important is, one, when you're role playing, you want to switch roles. You want to play the other person and you want to play the adolescent, because when you have the adolescent play the other person, oftentimes you get a better sense of what kind of response they may get. It also is a little bit more fun for the adolescent. They enjoy playing their parent or the other person. They can ham it up a little bit. They can joke around, and it's very helpful in terms of thinking about who they're going home to have the conversation with. Also, by you playing the adolescent, you do good modeling of what you want them to do in this conversation. So it's really important to do both roles, to switch at some point before you send the adolescent home. Whoops. I have a few more things to say. The other thing that's really important is you don't want to role play the perfect scenario only. It's really important to anticipate. You can't control the other person that they're going home to practice this conversation with. So you really want to anticipate, well, what if they don't respond the way you want them to? How are you going to respond? So you sort of generate worst case scenarios if that other person doesn't respond in the desired way. If you don't do that, usually the adolescent's going to be too afraid to go home and try to have the conversation. If you've prepared them to be able to handle the worst case scenario, then they feel like they have the skills in order to be able to do it. So before you send them home, one, you have to think about and talk to them about when they're going to have this conversation, where they're going to have it, how they're going to initiate it. You've reviewed the worst case scenario if it doesn't turn out the way the person doesn't respond the way they want them to, so that you've rehearsed all the different scenarios, not just the ideal one that you're hoping will happen.
So just to add in a couple of points, I think that one of the things you want to be paying attention to as you're planning the role play is if what they're communicating doesn't in fact match with what they said their goals were for the conversation, and then maybe modifying what the goals are for the interaction. So an example is a girl who was in a fight with her best friend, and she was in a fight with her best friend because the best friend found out from somebody that she was supposedly spreading rumors about her. And so her goal for the conversation, according to her, was to make up with this friend. But as we started to script it, what became clear was her real goal was to find out who told her that she did that, because she wanted to go beat up the person who had said that. And so we kept scripting, and she kept saying, yeah, I want to do that. And then the very first thing would be, well, who told you that? And so we were able to sort of talk through that, in fact, maybe that wasn't her goal, and then move to a little bit of a decision analysis of, well, we've got these two possibilities. You can have this conversation where you'll find out who texted this person this information, or we can have the conversation where you're apologizing, and how do we think each of them is likely to play out, and then being able to sort of modify that. So if you're noticing as you're scripting that there's ambivalence or that they're communicating something, you want to help give them that feedback and try to sort of further think about what it is that they want to do. The other thing is that you want to think of a way to end the conversation as well, because we're doing a great thing by helping them start it, and we all know from our own lives when you have to have a conversation with somebody about something that happened a while ago, it's really awkward to bring it up. So it is very helpful to be able to say, I wanted to talk to you about what happened last week and have an introduction. But we also want them to have a way to graciously end the conversation if it's not going the way that they want. So if the purpose is to be able to go out with your friends and you try all your great techniques, we would like the conversation to end before it escalates and gets bad. So it may be that we can't change the outcome of the conversation, but we can change the feeling behind it. So being able to say sort of, I hear you, I still really want to be able to go out with my friends. I don't think that this is fair, but I really appreciate that we were able to talk about this calmly, and I hope we can talk about it again sometime. Because that can really save them from it getting really ugly over time. And then the last point I have is just to use you as much as you can in the role play, to think about how they are communicating, looking at their nonverbals and all the things we're paying attention to in the communication analysis, and then to give them feedback about how it's coming off to you as the other person. We want to be selective in the feedback we give. We don't want to do a role play and then tell them the 15 things they did wrong, because that's not going to make them super confident to try it out. But you can really stress, wow, you really did this. You really put yourself in your parents' shoes. You gave to get. It was a really nice I statement. But I noticed that when you said the I statement, you also really said to your mom, you always do this. And when you said you always do this to me, it made me kind of want to argue. So let's think about how you could say that piece differently, and I might have a different reaction. And then you can sort of practice that again. So to use you and the information they've given you about how the other person will respond to give some feedback to try and improve the situation.
The other thing that I want to talk about is how you present the teen tips to the adolescents. So you have some flexibility as a therapist in doing that, but my recommendation is not to sit down in one whole session and start to just go over the entire teen tips, but to think about what you've learned about the adolescent during the interpersonal inventory, what you've seen as some of their communication problems, and pick one or two to start with, teaching them in the middle phase as you begin to work on a specific problem area. Pick one or two that you want to start to teach them first, that you think will be most helpful given the communication or relationship problem that they're having. And let them start to master those two before you go on to another one. So I would do it gradually. You don't want to bombard them with, here are all the communication techniques that we want you to be able to use all at once, but gradually introduce them and have them begin to practice them in between sessions as you add into their repertoire with the other ones on the teen tips sheet. And then lastly, we like to avoid the word homework, but what we really like to have the kids do is our between sessions work at home or interpersonal experiments. I like to pick out things from an adolescent's life, and so I like to talk to them about they're in science class, they're doing chemistry experiments, they get different powders. If you use these powders in different amounts, you'll end up making a solution of different colors. And so what we're doing with our communication techniques is we're learning to use different techniques in different amounts And our different colors are going to be the different outcomes of our relationships. And that's sort of the experiments that we're doing. And in chemistry class, you have to play around with your measurements sometimes to get the exact color that you want. And we're going to be playing around with our communication and our strategies till we get it right as well. So it's an experiment, it's a process. And when we ask them to go home and do something in between sessions, we don't want them to think about whether they failed us or whether they succeeded, but that it's data and it's just more information that we're going to be using to continue to refine our measurements. The point of the interpersonal experiments or between session work is really to support what you've been doing in the therapy session. You want to facilitate them feeling that these skills are a part of them and that they can begin to internalize them as much as possible. And the only way to do that is to increase the amount of time they're practicing and using them. So that's why you're coming up with things for them to use in between sessions. The difference between IPT and CBT is that many of our CBT manuals come with a nice homework notebook and sheets that the therapist can rip out, and it's all developed to a large extent for the therapist. We're depending on your creativity in IPT. We don't have homework notebooks because, in fact, we find that adolescents find that aversive to think of it that way. And we want the in-between session experiments to really be a natural outgrowth of whatever you've been working on and talking about in the therapy session. So it demands a bit more creativity from the therapist to tailor the experiments to that specific patient. So while you're doing your discussion about a conflict or problem solving, you're beginning to think about how could you craft this and shape this into an experiment and something that the adolescent can practice in the session and then take it home to do. So that's where it could be a conversation. As Jamie said, it could be making a decision about a situation. Am I going to get back together with my boyfriend? Am I not? How am I going to have that conversation once I make my decision? These are things that you want the adolescent to be practicing outside of the session. And so you're thinking about it while you're talking to the adolescent and you're crafting something. One of the common errors that therapists make is initially picking something that's too broad. It's really important when you begin to assign experiments in the middle phase that you pick something small and concrete to start with. So, for example, I'd like to be able to go out to the movies on Friday night. That's really small versus I'd like to tell my mom, I'd like to have a discussion with mom about I feel she's never trusted me, she doesn't like me as much as my sister. That's not a conversation that you want to practice and have the adolescent do. There's way too many pitfalls. But asking if they can go to the movies with a friend is something that's concrete and has a greater likelihood of success. So you want to keep in mind that you want to start small with something specific and that you think has a good likelihood of success from what you've learned about this teenager and whoever else they're negotiating with or communicating with in this interaction. And your goal, again, of these exercises is to help the adolescent to gain mastery of their skills so that they feel that they're going to be ready when the 12 weeks is up to be able to continue to do this after therapy's over. The middle phase is sessions 5 through 9. The structure of these sessions while you're using the techniques we talked about yesterday, but again, don't forget, in the beginning of every session, you're reviewing the current depression symptoms and you're using that mood rating. So again, you're going to start the session with how's this past week been? You give the kids a chance to blow off a little steam, give you a hint of whether there is a problem this past week that you're going to have to check into. Then you go back to review your depressive symptoms. let's just check in on your symptoms before we start to talk about some of these things. Sleep, appetite, always check in on school. I didn't say yesterday, but if you're dealing with adolescent girls, a lot of depressed adolescent girls engage in high-risk sexual behavior. So part of my symptom check-in, especially if I know that they're dating and have boyfriends, is to sort of question them about whether they've gone out with anybody, are they practicing safe sex? Because a lot of depressed girls really put themselves at risk sexually, and so we want to monitor that as a symptom of their depression as well. You always want to ask about suicidality. You want to get them to do their mood rating, their average, their best, and their worst, and link them to things that have happened in their relationships. You're going to help focus on the identified problem areas, so you're going to ask them whether anything happened that relates to what you've been focusing on in treatment. So if you're focusing on your transition to a new school, anything happen in your new school this week? How's it going? Did it feel better? Were there difficult situations this week? Get them to talk about them and talk about them in detail, linking them to their mood. And always, after you review your depression symptoms, if you've assigned an interpersonal experiment, you want to follow up on that. So if I've assigned something, after I finish my symptom review, I'll say, so last week you had something that you were supposed to be doing in between last week and today. Let's talk about that. Did you get to do it? If they didn't get to do it, what stopped you from doing it? If they did do it, you want to hear about how it went. You want to see how you can tweak it. If they didn't do it, you have to spend some of your sessions sort of problem solving what stopped them from doing it. Was it that you didn't prepare them enough on how to set it up? Was it that something else happened at home that it didn't look like a good time to try it? You really want to find out what were the barriers to practicing, because you want to figure out how you can get them to be able to do it in the next week.